But we know with these rotations, as this tooth is coming up and it's all cattywampus crooked, we know it's like butter. We know that it's going to come in, we're going to guide it right where it needs to go, and we're going to see it quick. Conversation is not going to change. It's just going to get worse. Just like with
Dr. Jill Ombrello conducted the 3-day conference covering 50 years of advanced orthodontics.
Perfect smile, you know they're an orthodontic patient. You know. So why are you going to wait till they're 12? Let's fix it right now.
The HealthyStart lecture series in Northern Virginia and Washington, D.C. area introduced a new premier HealthyStart provider, Dr. Linda Dean DeRue and her Ashburn Children's Dentistry.
For us, it's another mission, and we feel good to be pioneers in our area. We don't say we're the best authority on pediatric dentistry in our area for nothing. There's a reason for that.
Ashburn Children's Dentistry is a stellar pediatric dental practice with patients that simply refuse to grow up because they love their dentist.
What did he do?
He fixed me up. There goes the answer.
There goes. Woohoo!
Dr. Linda, as she's known by her young patients, had known of the treatment used globally on millions of children with great success and for decades, and found it to be the best advanced tool to help children at risk with the many sleep-disordered breathing issues that come along with a restricted airway and oxygen deprivation. And the parents are now learning that it may be the dentist that is the best detective piecing together the clues that otherwise leave parents and teachers baffled as to why these children are so challenged.
She's a mouth breather, so she breathes through her mouth. It's better to breathe through your nose because you take air in, your nose humidifies, purifies the air, and brings it into your body, into your lungs, and gets it ready for your body to use. The root cause is your daughter is a mouth breather with an anterior tongue thrust. That is the root cause. She has sleep disordered breathing. We're really concentrating on her sleep right now because that's a real serious concern. If that's my daughter, I'm just as concerned as you are as a mom.
You want to find answers for them, and being able to help one of them find the answer to that, not only could you sleep better, you breathe better, plus you get straight teeth on top of that.
We won't let them go.
Next is a really young patient at 18 months who's sucking her thumb. But Dr. Ombrello helps this mother go forward to replace that habit.
This is pretty exceptional. Most 18-month-olds, their parents don't have them drinking out of a cup. Can you drink out of that?
She was breastfed.
Breastfed for how long?
And she's still doing it.
You are super mom, aren't you? Jeez, that's incredible.
She does sippy cup and a cup.
And a cup.
Yeah, she doesn't do bottle.
All we want to see is the movement of the muscles of her neck when she swallows, okay? So as you see an increase in that mentalis fold, she's having to use that, right? That muscle, I just exaggerated, that muscle to form the seal to swallow. So we're already seeing a deviated swallow at 18 months of age. We're not going to break it, right? We're going to replace the habit with the habit corrector. So she's not going to, instead of sucking her thumb, she's going to put that appliance in. You guys, I have one 18-month-old patient, that's the youngest patient I've ever served. I really looked at the mom and I looked at the kids. So this little kid, she came in, she was surrounded by people. What'd she do? She's amazing. She looked at every single one of us in the eyes. She went around the group. Her mother is still breastfeeding. She's working on potty training. This is a really, really spectacular kid and a spectacular mom. She doesn't use bottles, she uses sippy cups, and she uses regular cups. That's exceptional for an 18-month-old. That's absolutely exceptional. So she's way ahead of the game here. So I think that she could be really successful integrating this into their routine because she's not going to give her daughter an option. She recognizes the importance of it. She's the adult, she's the mother. There's no negotiation. What she says goes. Am I right? Yeah. Absolutely. This is a great example. Let's say it's not. One thing I would tell the parent is, I don't think right now is the right time. And reassure the parent, you're not going to do irreparable damage. We'll see this child every 6 months at their hygiene care. We'll evaluate her behavior and her development, and we'll introduce it as a bright time. Typically 2.5, 3 would be a more normal talent, but for this little kiddo, she's ready to go.
Many people don't know. I mean, there's some of my colleagues who don't know. I'm sure I'm going to get pushback just like anything else we start. We always try to think outside the box because we're looking at a whole human being, not just teeth. And so initially we're going to get people who say, oh, you do this, you overdo this, you overdo that. Well, there's a lot of research on this. And tell me who doesn't want their child to be better than them.
Well, I wore braces for a long time. So as someone that wore braces, I think it's phenomenal to be able to do something proactive when it's not obvious all day long every day, and it's something that they're doing at night, and it's correct. I mean, it doesn't just correct their teeth, but it's correcting their breathing and their speech.
One more time, big open, and close.
Was it within 2 weeks that you were able to keep it in all night and sleep with it?
It took a long time, and still now sometimes it falls.
But when you first started being able to, it was a couple weeks before she could sleep through the night and keep it in all night. And once she was able to keep it in all night, that's when it really started to make a difference and you could start seeing changes happen.
Maintaining that 2 millimeters overbite overjet, she has these big, beautiful teeth that we saw on her panel as they were erecting. So I knew that her permanent teeth were going to be much bigger than her baby teeth. But so I always take a look at that overbite overjet. The worst thing I could do is overcorrect it, and then she has that late pupil growth spurt, turn her into class 3. Yeah, so we definitely want to take a look at that.
Once she started wearing the appliance, her teeth, like her jaw, I guess, spread open, and her other teeth had more room to come in. So it was really, I mean, it was exciting to see that as she lost these baby teeth, there was space for the big teeth to come in afterwards. She used to have her top and bottom teeth were very close together, almost to the point like to someone, we used to laugh, she almost had like a bulldog smile when she's not, because her teeth were right like that. And now it shifted her jaw till it's like her jaw, like her teeth line up, I guess, more properly.
How do you feel about the fact that there's no pain and no pharmaceuticals?
It's wonderful. It's fabulous. I definitely, like I said, and the fact that it's hard enough being a kid now, so to be able to do this at night and not have it affect your day or your friends and no one sees it, and it's a great option and alternative, so we're thrilled with it.
Their compliance is absolutely perfect. Their dream patient.
Not knowing that the reason they were doing that is right in my face. They're breathing through their mouth. Their tongue is not placing correctly, so they're struggling. A lot of them are grinding their teeth because they're just trying to get air and get comfortable. I'm Dr. Linda. And nice to meet you. Very good. And Mom, you had this all filled out? Yeah, that's the questionnaire about how well she sleeps?
Yes.
Very good.
He actually does have many, if not almost all of the symptoms. That kind of doesn't sleep through the night. It's like every 2 hours it's like, Mom, I just don't feel good. She wakes up, my head hurts. Every day it's kind of always the same thing. So this, I'm a little more than excited right now, just in hopes that this could really help alleviate the problems that I've been having, because having to give a child 3 or 4 medications just to walk out the front door, it's just kind of stupid, and in my opinion it takes away from her quality of life, because I have to worry about all these things, and then she goes to school and it's like, well, she can't sit still and she's always fidgeting, and then it's like, I just know it's probably another label that'll be tossed on top of a growing list of things, and it's like, I think I do a pretty good job of being a parent.
Does she share a room with anybody? Anybody sleep with her?
I sleep in a room with her because of her asthma and stuff and her breathing issues.
Does it keep you up at night?
Smile for me, sweetheart.
Like, I never get into deep sleep because I'm always like listening out
Look
for
up for
her
me, honey.
coughing and just
smile.
like the
Big
gap
smile.
in the
Just
breathing
regular
sometimes.
smile. She snores.
Grinds her teeth. That's
Grinds her teeth.
Oh my gosh,
Okay.
that is distracting. Oh, she was on a pacifier way too long. So
Okay.
2.5. She
2.5.
still had one going
Okay.
into 3.
They passed it to 2.5.
Let's put a question mark. I think it's adequate, but let me know. They're going to be able, the doctor will be able to tell on the cast.
I would say she's normal.
I would too. How about her nose?
Those teeth. Beautiful.
How about her upper face and lower face?
What do you think, Goofball?
It's proportional.
Great. So did you see how I kind of drove the
Yeah, you
appointment?
literally went through every single one, pretty much, other than the ones we can get
So
from
this
the
should have been
patient.
filled out before she
Right,
came
right,
in. This should have been filled out before she came in. Habits, we could have, we should have had that filled in before she came in. Miscellaneous questions, this comes in the initial interview when you're talking with the parents and you're evaluating her speech.
Okay.
So yes, so now until the doctor realizes exactly what they need to look for, you're gonna, what works in my office is drive the appointment. So, hey doctor, can you tell me about the overbite overjet? Okay, is the overbite or open bite or class 3 present? So you're going, so you make sure you have this all totally full. When you're done, you're then gonna give it to the doctor to evaluate, make sure everything's filled in correctly. You're trying to get rid of that. How's that going? So you pick up the conversation right where you left off. It builds a lot of trust with patients, and they're really excited to hear, oh, you
But
remember.
I do believe that prevention is key. Prevention is paramount. Why do I want to wait until the problem occurs to fix it if I know that I have something to prevent the problem from occurring?
So this is why we all became doctors, and this is what we want to do, help all the children that come here and who want to be helped.
Any dentist that you can find out here anywhere in America can treat teeth. What we're concerned about, especially with this appliance, is the welfare of your child, the health of your child. And you're not going to find dentists all over the place who are willing to do that. But here in our practice, we're trying to treat your child as a person, not just treating them as a set of teeth.
Got nothing in my brain, cause the player's gonna play. And the hater's gonna hate. I'm just gonna shake it out. That's what people say. But I keep cruising. Can't stop, won't stop moving. It's like I got this music in my mind saying it's gonna be alright. People say, but I keep cruising.
Every child in Washington, D.C. and Northern Virginia is in very good hands with Dr. Linda and her amazing team of pediatric dentists and specialists. This is a great home for HealthyStart and for your child.
I have a python, tarantula, some bearded dragons, a chameleon, and a gecko.
Do they ever get into Morgan's room? No.
And no cavities.
All right.
Very cool.
We're thrilled about that.